When you have a doctor in Quebec, you consider yourself lucky. But with the province looking to improve frontline care for vulnerable patients, Radio-Canada sources say the government is considering a drastic move. Patients considered healthy could lose their doctor or be put down the waiting list. The idea comes after the release of a report commissioned by the Health Ministry. The National Institute for Excellence in Health and Social Services says out of 2.1 million Quebecers without a family doctor, 500,000 of them are considered either seriously or moderately sick. It suggests reallocating 1.5 million doctor appointments each year to serve them. The option under discussion would have only patients with complex or chronic conditions like cancer, mental health issues, cardiovascular disease, or diabetes be directly assigned a family doctor. The idea isn't landing well with some, especially coming from a government who campaigned providing a doctor for all.
I see no reason why the people of Quebec should accept anything other than a commitment from their government to ensure that every single resident of Quebec has a family doctor and access to an interprofessional healthcare team.
Patients considered healthy would instead be shifted to a modified version of the so-called GAP system, which offers appointments to patients on the waiting list for a doctor.
The thing about family medicine is everybody needs us eventually.
Some wonder what will happen to preventative medicine.
And I think if people aren't given the chance, then we're going to be doing reactive medicine and not proactive medicine. And there's so much to be said for preventative medicine, that the more we can manage early on and intervene earlier in a disease process, the less suffering, the less morbidity, the less mortality, the less cost to the system we're going to have later on.
Most patients also express concerns about the plan.
Everybody should have the same priority.
You might be well today, might not be well tomorrow.
Though some are more altruistic.
If it's for vulnerable people that really needs a doctor, family doctor, I don't mind. I work in I'm studying to be a therapy nurse. So I know we're seeing what it is. I know people wait a lot of years to have a family doctor.
In a statement on X, the health minister said it was too early to determine what would come of the scenario proposed by Ines. Quebec's Federation of General Practitioners also declined to comment.